Today, we are going to talk about a topic that every caregiver of somebody who has autism or someone who has autism is interested in, and that is mental health. And there are so many different ways to explore this, and the times they are a-changin'. So I have the best guest imaginable to talk to you about this, and I hope you already know her. It's Dr. Taylor Day, and she is a licensed psychologist, and she is joining me today. I am so honored to have you on, Dr. Tay.
Thank you so much for having me. I'm excited that you've started this and to be one of your early guests in this journey.
I know. I was just like, I got to have her on. I've been following you and listening to your approach on all of this. I just eat it up. And the reason I do is because of your open-mindedness to not being stuck with what you learned in school and not being willing to look outside of that from now on. And that's been such a challenge right now, is finding the professionals who are willing to say, hey, you know what? This wasn't taught to us in school. Presuming competence wasn't necessarily taught. And now we're looking at autism in a whole different way. It's such an exciting time for me. As somebody who's been at this for 30 years, to tell you the transformation that I have seen in 3 decades is just astronomical. But there's no greater time than right now. And what we are learning now is huge. So I wanted to have you on to explore this because my mind is racing with, well, we never thought about this before, but now that we're thinking about this, it's going to change this. And how is everything from diagnostic codes to what we call it to everything is going to be changing, I think. And you either have to get on to the party or stay home because it's moving without you. So what has been your biggest exciting revelation over the last, I'm even just going to say 1 year. We don't even have to go back really far. Over the last 1 year, what are the newer things that you're starting to learn?
Yeah, that's such a good question. It's hard to remember timeline because it feels like it all
Yeah.
blends
Okay.
in.
More or less.
Yeah, but it's interesting because I was in academia before this. I was doing autism research, and I started to hear about neurodiversity, but it was really slow to make its way there. But I also, and I talked about this very openly, had a lot of resistance to it at first. I was so nervous that this concept of neurodiversity all of a sudden was going to make my job like disappear, like it wasn't going to be needed anymore. And then when I you we all have fear. We all have those initial things that kick in. When I slowed down, started to learn, I realized that is quite opposite of the truth. There's still a place for clinical professionals in this neurodiversity affirming world, but being willing to adopt to that was going to be so incredibly important. But the other piece that real quick I always talk about that makes it so hard for clinical professionals, medical professionals, therapists, things like that, to jump on board, educators is another one, is our egos are involved. As humans, we all have egos, right? And I even experienced this myself that if I needed to do it differently, this meant I did it incorrectly in the past. And what does that mean for admitting that I did it incorrectly? It's really
Right.
hard to. And even going as far to think about, did I inadvertently create a traumatic experience for a family that I was working with? That's hard to sit with. And I have a decision point. It's like either admit that it was wrong and start to do things different, or I can just stay in this stuck pattern and keep doing this over and over until like a shovel hits me in the side of the head type of thing?
Well, we talked about this topic on my end
Yeah.
when I was on your podcast because yes, I mean, we ran this autism clinic for 16 years at a long time ago, and thoughts were very different, and we did not say the things to parents that we say now. And it is a big, shovel in the face kind of a thing. But this is what I love about you and why I love your podcast and why I love your social media page is because of the willingness to kind of go outside. And you have to be seeing it from your colleagues' perspective as well, too, because I know as a professional, and this was very much the way that my late husband was as a pediatrician, he had those who were just like, we're not going to look at it a different way because then we're going to have to change. And then there was those who thought he was a maverick. And then there are those who just thought he was freaking crazy. So you have to, even in your colleague perspective and watching with holding your credentials, being careful of what you say, I'm sure as well.
Right. I feel like I straddle two worlds sometimes, and there's not a roadmap for it of like, what is evidence-based practice? Because that is how I was trained. I went to a PhD program that was highly driven by research, and I still value research in all of this. But I also recognize how incredibly slow research is and how much it hasn't caught up and how much it hasn't uplifted, autistic voices as a whole. It really, a lot of autism research is more on low support needs autism. It's rare that we're investigating moderate and high support needs. Those are often exclusionary criteria in research. BIPOC, that's a really big thing where we're studying a lot of white boys in research. And so it's like,
Interesting.
I find the value in research, but I also know that we need to progress and think about truly the entire spectrum and how we create support. So sometimes it's a little tricky of like, okay, like some of my colleagues that are really strictly evidence-based still, I see some of the value of what they're saying, but then I listen to autistic voices. And I mean, I could give you a million examples, but something like exposure therapy for anxiety, right? Like you'll hear from the neurodiversity community, or the neurodiversity movement, the autistic community, like, no, exposure therapy is traumatic, but then we know it's highly evidence-based. And so my question is, where's the intersection in that? And I truly believe that there is an intersection in that because anxiety is so distressing. And when it's co occurring with autism, we can reduce some of that distress. We can improve quality of life. But the key is, how do we get consent in this process? How do we
Yes.
involve, I work primarily with kids. How do we get their buy in and them wanting to do it in a really meaningful way? And also us thinking, like, what is the benefit for them in this? And I think there's ways that there is this intersection. And so I won't lie, sometimes it's so incredibly frustrating. Like I go to IEP meetings sometimes, work with educators, speech therapists, occupational therapists, pediatricians, psychiatry, like all of these fields. And sometimes it's just like, well, no, what does the evidence say? And it's like, have we taken a step back and thought, like, is this actually supporting the child?
I love this. Thank you for that. Of course, my big draw these days is the spelling to communicate because I have my personal experience with it. It blows my mind that I can have personal experience with it, see it with my own eyes, see the wonderment of how he's communicating and have it still be completely dismissed by ASHA, which of course in turn affects the psychiatry, psychology, the whole gamut of it all, because there's an interweaving of it all.
Yep.
And the fact that it is so shut off that the voices that are now coming out of our children are not even listened to because in their opinion that's still not evidence-based.
Right.
And what are your thoughts on that?
I think that's the harm of like going all in on evidence-based practices. It's really interesting. Like I was in research, I saw how things unfolded. It takes so much time to get a study funded, run the study, publish the study. Like, even once you analyze the data, I am not kidding, it usually takes anywhere from 6 months to a year to even get it out there and published. And then, at the same point, then we need to replicate it, And so like for something to become evidence-based in the research community, I think is, it's slow. But what's really interesting too is I see speech therapists in particular talking about this, and I love how they frame it is evidence-based isn't just research. Evidence-based is also lived experience, right?
Well, I love that.
Yeah. And it's also personal
Yeah.
opinion too.
Oh,
There's things all the time that I do where I take my knowledge and use that knowledge to think about what is going to be best for this child and family. How I practice like with this like whole family approach, and
yeah.
focusing on the entire family unit. Yes, we have decades of research of family therapy, things like that, but there's elements of this that aren't evidence-based, but you know, as a sibling, I got to live this and know how it impacts, and I'm listening. So, clinical opinion, that lived experience and research can combine. And I think we need all of those quote unquote voices in this picture.
So good. That is one I wrote down because I want to remember that a lot. Evidence base is lived experience. And it reminds me of what Kai Dickinson's been saying about the evidence base of showing, an example to spelling to communicate is that, when Jane Goodall went out into the field to study the chimpanzees and the gorillas, I guess. Sorry. I'm not an expert in Jane Goodall. Also, the fireflies she makes the example of. Like, you can't bring fireflies into a lab and expect them to light up. So it's very, very similar with a lot of our spellers, is that they're not going to necessarily be able to perform, and a lot of them can, but we have to get off of this too much of not understanding that they're like, one of my thing is when Joey is spelling and people have said to me, but you're holding his hand. I'm like, okay, so I'm holding his hand. And of course, for the evidence, they don't want us holding the hands, but it really helps Joey for me to hold his hand, mostly because he has apraxia. He doesn't know where his hand ends. So he needs me to kind of touch him and press against him to help feel more comfortable sometimes. And then the funny thing is like, well, you could be giving him messages. I'm like, so you can believe that I'm giving him some sort of Morse code in his hand, but you can't believe that he knows how to spell?
Right.
Like, what is that?
Right.
So it gets to be a little almost like hyper critical of the methods being done. And what are you, what is your extreme goal in trying to disprove this?
Yeah.
And go ahead, please.
Well, I was going to say the thing with research, though, is we're limited by methodology too. So they want it to fit in this box. But what if there's other ways that we need to be studying things that we also haven't considered and discovered yet? And I think that that's important to keep in mind, that there's certain approaches and methodologies used in the research field that don't necessarily, it makes it difficult to map on. For example, we talk a lot about like what autism is and all of this. And like, there's varying presentations of it. And something that's really also, I hear a lot about spell to communicate, like Gestalt language processing, PDA. Those are some of the things that I've been diving into more. But something like PDA, pathological demand avoidance, is not a well-studied construct. And we absolutely need more research on it. But it's really interesting because I think we need to also think about what are some of the limitations of our current research methods. So I hear a lot that, okay, there are some findings of how, PDA is more related to things not autism. Well, our measures of autism and how we quantify traits actually suck a lot of the time. So, and yes, I still use them in my practice. That's the thing. I think we can have this and where I can use them as data, but how I'm analyzing them helps me get to my conclusions. But if we're relying on a measure, it's like, well, what if the limitation is the measure itself and not, and so we're limited in what relationships we can find. Or I also think about this too, you're talking about with Joey, like, okay, so we shouldn't provide that accommodation. Like, that feels not affirming at all. Like, he needs that accommodation in order to be able to access this form of communication. That truly seems absurd to me, right?
I want to talk about that absurdity a little bit, because what is going on in an ASHA meeting when someone comes in and is like, but there's a lot of evidence out there. We really need to be studying this. And what is the higher power saying? Is you talked about earlier about egos. Okay. But I can't even imagine the amount of layers of structure that would come crumbling down if the belief system of presuming competence, that they understand everything that's happening, every single way that these individuals need to be looked at and understood, it's like the foundation of it all almost is crumbling, and it's going to trickle into everything. Like,
Right.
what is happening in their minds? Is it, I'm assuming there's a lot of fear in
It's scary.
what it's going to mean.
Yeah.
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 because it does have to be rebuilt. And the other thing that I'm interested because of a diagnostic perspective. Now, it's so funny because I've been watching even on social media for the last 5 years, like all the different names that are coming in. Like back in the day when Asperger's was a common name, and now it's like, no, we do not say that anymore. And then it's the high needs and lower support needs, the higher support needs and lower support needs, which is a great way of saying it, which I'm totally on board with. And it changes and it morphs and it changes and it morphs. And now what I used to call as an intellectual developmental disability, autism falls in the intellectual developmental disability. I'm like, wait a second. He doesn't have an intellectual developmental disability. He has a apraxia that makes it impossible for him to express his intellect, but it's not necessarily IDD anymore. And it all kind of gets jumbled.
It is.
Yeah. I
Yeah.
mean, what even is it? What are you feeling is the solution to diagnostic criteria?
Yeah, it's really interesting because I think being in the neurodiversity affirming space, I'll hear a lot of like the problems with the DSM. I'm not
Yes,
saying there aren't problems, but we have to have some sort of classification in order for
understandable.
individuals to get services, right? And so I think throwing the DSM out completely isn't a solution in my mind. And that's not because like my job relies on it. I just think it would become like
I
so
get it.
confusing of who gets services, who doesn't, that type of thing.
Truly.
Yeah, but I also sometimes think that the problem is with the user of the DSM and not the DSM itself. So, and I see this all the time. My practice, we very, very commonly get referrals for second time evaluations where a family has already been told no, this isn't autism, but then the family is like in their gut, they know that it is. And pretty reliably, we're diagnosing autism. And the reason being is they're more subtle traits, right? Like there's more nuance to it. And someone, prior was using the DSM in such a rigid way, being like, well, they don't make diagnostic or meet diagnostic criteria. Like they make eye contact. How often do we hear that, right? Like, oh, your child can't be autistic. They make eye contact. And it's like, there are 500 million like variations of eye contact that I can look at. You also don't have to have, differences in eye contact in order to be diagnosed. You do have to have differences in nonverbal communication, but it could be where, you have a generally flat affect, right? Your eye contact's great, but you're not emoting on your face. Well, that can, you know, meet diagnostic criteria. Or it also could be they make great eye contact when they're talking about their interests, but every other time they're not. And so we're going, oh, they're making great eye contact. It's like, yeah, they're talking about Bluey right now, or they're talking about Mars right now, right? Like that's what they're like so passionate about. But so it's this nuance. And so I know that feels a little harsh saying it's the user, but I do think, even within the
Great.
psychology field, so many psychologists are not trained in autism and like really understanding what the profile can look like. And there's some amazing psychologists who are really paving the way forward in helping clinicians.
Like you.
Well, thank you. Like learning what some of these subtle presentations are and all of that as well.
How much do you learn? And I hope that you're willing to not feeling concerned to admit this one, but how much do you learn from social media? And yet so many professionals are like, oh, you must have learned that on social media. And I'm like, but social
Yeah.
media is the most current information that is out there right now. And that's where I'm learning. I can't even I can't even believe. In fact, I learned from in myself in that the terms that I used even a year ago on my social media pages, I would never even consider using now.
Exactly.
Severe, like Joey was technically diagnosed as having severe mental health. He doesn't have severe mental health. He has apraxia that forces a lot of different things, and he has frustration because people don't understand him, and he's so brilliant and he understands what's going on. So it's like, but the calling it of severe mental health, I actually have guilt over now, even though I spent a lot of money getting that diagnosis, which is super interesting.
Yeah.
So how do you feel parents can discern on social media what is fact and what is somebody having a good day and saying, oh, I tried this and it worked because they had a good day. And then the next day, what happens is it's not working, but the parent doesn't come back on and say, oh, it's not working anymore. Like now all of a sudden, all these people have these false hopes that this one thing made all the difference, and it doesn't necessarily. So how do you help parents discern the fact from the fiction?
Yeah, I mean, I think it is really, really tricky. I think first and foremost, these are like related indicators, but look at, is this, if it's a parent, for example, or an autistic, self advocate, are they sharing the good and the hard, right? Like if they're not
Yeah,
sharing the hard at all,
good
like all
point.
you see is the good, that's a red flag for me because, and they have a right to be able to share that. Like they can use their social media how they want. They can tell their own or their family story how they want. And I think that's important. I don't think we need to shame them for it. I see that a lot,
Yeah,
as well.
yeah, yeah.
But I do think to know, does it apply to your child or does it apply to you? If they're not sharing the hard, it's not realistic. And that is true outside of the autism space, like it's funny, I like started a travel account for fun and I said to my boyfriend, I'm like, I don't want to share like all the good things. Like I want to be real about this because humans, like we have bad days, right? We have hard, and I think if we don't talk about those, it's so easy to get trapped into that piece of like, oh, well, their life is so much better. And it's like, no, no, it's. So I think,
It's good.
yeah, I think that's a huge indicator I would start with, for
Yeah. It's been interesting with Joey because now that he's spelling, I ask consent, which I love to be able to do it. And there's some things he's very much consenting on, and some things there's not. Now I make the choice never to show any sort of a meltdown on Joey's behalf. I'm not criticizing anyone who does, but it's something that I choose not to do. But I
Yep.
talk about it. I talk about the fact that we have meltdowns and all of that. But it's funny because like one of the first things that I ask consent on, Joey wears this vest that says autistic be kind. I don't put it on him every morning. He puts it on every day. And I'm just like, why is it you want to wear this? And he spelled that he says people are nicer to me when I have it on. So I was very excited about that. But it's very interesting, that's probably the number one criticism I get is why would you display what your son's going through? And it's like, you're forgetting the fact that he has an opinion too in all of this. And I certainly don't love the fact that he'll go out in public with his arms stuffed, looking like I put him in a straitjacket with the sign that says autistic on it. That's not who I am. That's who he is. So it's a hard ego piece for me as a mom saying people are going to stare. People are going to think I'm a terrible mother. People are going to, da 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 da. And they do. But knowing that my son's comfort in his body is more important to me than what everyone else is saying about me. And so in showing, and that's part of like the showing the good and the bad. But one other thing I wanted to say to that point is he used to be fine with me recording his spelling sessions. And then all of a sudden he wasn't. And it turned out he spelled for us later when we asked, it's okay if you don't want to be recorded. But he says, because there's a lot of people who are saying that if you're touched, it's not real and that it's not good for the statistics of the studies. So because you're touching me, he says, I don't want to be a representative and have people get down on spelling because of it. So that, and so it is interesting when we're talking about like what it is that we're willing to show, what it is that we're getting consent to show. I wish there were a lot of things that I hadn't posted years ago when I didn't really understand that he was so understanding of everything. But I think what you said earlier is that you're not in a critical state, is that we're all going through different paths in this. We're all going through our different struggles, and we're all grasping on to whatever it is we can to be able to hold on to this connection that we have to society, because so many of us are trapped into our world with our child that we are looking for anyway. Has anyone else seen anything like this?
Yeah.
I had Joey's eye vision issue was
Yeah.
completely pointed out to me by social media. So what an appreciation I have for that when someone's like, he probably has BVD. I'm like, what is that? And then he did. And it made such a huge difference in his life. So yeah, social media has its good parts and bad, but I love what you're saying. Are they showing both sides of it? I think that's just a really great way to look at it.
Yeah, and real quick, I don't think that means that they need to be showing meltdowns, right? Like, I think we need to be consenting and, like you don't have to show it, but you can also talk about it. Or even like if you're a parent on social media, talking about your experience of the heart. It might have nothing to do with your autistic
Yeah.
child. What are the stressors of having to be, one appointment at noon and across, that's an hour appointment and across town by 1:30, like there's so many factors and so much that we can bring to this that helps it become real without, feeling like we need to display everything. I have boundaries in this of what I will and won't share on social media. And I think everyone should. But I do think talking about the hard and acknowledging it is super important. The other two things that I would say is watch for overgeneralizations, where it's like, this is my experience, so it's going to work for everyone, And then anything that like offers like an immediate fix. The reality is that there is no immediate fix, right? And everything that we do, and this is something I work with families a lot, in clinical services, is I get you want that quick fix, but like that's going to work maybe for a little bit, or it might have a placebo effect. And then it's going to, disappear. It's going to take time and energy. And like the one factor we cannot get rid of is time. And so some of it is being patient. So if you see that, and listen, there are like medical professionals who offer these quick fixes. Just because they have a degree doesn't necessarily mean that they're trustworthy and reliable either. And so but and then one other thing I'd say is look for consistency. For example, you asked me like how much I've learned. I started learning about Gestalt language processing on social media, but then I started to dive into it further. I wasn't relying on a minute TikTok video or a
Right.
minute reel to tell me everything I knew. Like I started to do research, but the thing is I started seeing it across account and account and account. And then I was like, wait, I want to learn about this. This is one of the reasons I love my podcast is that I have guests on who also
I
teach.
know. It's great, isn't it?
And so I think that's the other thing is, are you seeing a consistency of this picture, and a lot of people talking about their experiences with it as well. And I think Spell to Communicate is a great example of that. We don't
It's really taken off with
exactly.
people understanding it. And they're seeing it. I mean, a lot of it is being filmed and they can see it firsthand. And of course, so many great documentaries.
Yeah.
One of my funny stories about one of the quickest fixes in my world was Joey goes to craniosacral, which has been very, very helpful for him. And I always say for him. Yes, I don't generalize. And therapist was explaining to me why Joey really loves that tight bound that he's always putting his arms in his coat and everything such as that. So I, on a whim one day, bought Joey a life jacket, which um, something when he got it home, he immediately took off all his layers, zipped up the life jacket, threw his arms in, and was the happiest I'd ever seen him. And that lasted for weeks and weeks and weeks. And now at home, whenever Sue walks through the door, he takes off his clothes and he puts on his life jacket. What was funny to me was when I posted about that, how many messages I got about, well, why don't you try a weighted vest? Well, why don't you try squeeze this? Why don't you try this product? Why don't you try this product? I'm like, sorry, but the $20 life jacket worked just great.
Yep.
Like it's always like, but there's got to be something better. There's got to be something better than that life jacket. And I'm like, he's so happy. Why do I need to go with something that's, custom made $200 for this particular need when he gets everything he needs from the softness to the zip, everything.
Love that. That's such a good point. But I think that, that's not specific to the autism community. There's
Right.
like this need for more constantly,
Yes.
and
Yes.
it's like more, more,
So
more,
true.
what's better. And it's like, is it working? And that's a question that I love families as a whole to ask themselves is it working, right? Like I value to hear that so, so much. I had a family this past week actually that I'm working with in a one-on-one capacity, but the decision was actually that this child needed to be hospitalized for medication stabilization. And trust me, like there's an entire team, we all thought about it, but the biggest guide in all of this is for the parents is like, is it working for your family? Is it working for this child? Is it working for you? And the answer, like recurrently, was no, this isn't working, and we're not seeing a way out. And so then it's weighing costs and benefits and all of that. But I think whether we're talking about a $20 vest or a really tough, difficult decision that you have to make for your child, I think it's so important to ask yourself, is it working? And really trust what your gut response. And what I hear in this is you're saying, like, yeah, the $20 vest was working, like, and just like trusting that and like,
And trusting that you're right, not second guessing yourself when you see that something's working. I love that. That is so, so, so good. So, Dr. Tay, so I did something it's kind of funny how it fell into place, but back when I got Joey's diagnosis of severe mental illness by going to a psychiatrist, and then like, okay, well, what do I do with this? Insurance said they would pay for therapy. They won't pay for spelling. They won't pay for just about anything, but they'll pay for him to go to a therapist. And I thought about for a while, I'm like, well, this is silly. I mean, he can't talk, he can't speak. Like, what kind of a therapy session is this going to be? But I'm like, I kind of felt angry at my insurance company and thought, fine, you're going to pay for something, darn it. We're going to go to therapy.
yeah.
So I found a psychologist who actually is neurodivergent herself, who I started to bring Joey to. And can I tell you, it was one of the most profound, life-changing things that we've ever done, Joey and I together. Of course, I was there with him, and she would speak to Joey as if Joey was in the room. So Joey was clearly understanding, hearing everything. Occasionally, he would use the spell board to communicate, but he actually didn't want to. He just kind of wanted to hear things. But as a neurodivergent therapist, she was helping me understand Joey, and consequently bringing down my kind of like confusion or anger or anything with it, basically helping Joey with his voice on it. And have you ever thought about it this way? And have you ever thought about it this way? And what would you think if you did it this way, or these things? And what a game changer it was. And it's something that I never thought that would have been helpful. To this day, he absolutely loves to go see his therapist, mostly because of the fact that, he feels heard. When I explain the behaviors, she says to Joey, this must be really tough for you, blah, 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 blah. And I want to address that because we have all these non-speaking individuals who have gone through insane amounts of trauma their entire life because of all that has not been understood about them, of us presuming competence.
Yeah.
What is your feeling about individuals such as Joey receiving therapy?
Well, I think there is so, so much value. And it's interesting. I was at a autism gala this weekend and had multiple conversations. And I had someone ask me, like they knew I was a child psychologist. And she was like, my son's autistic, but do you work with, individuals that have intellectual disability or intellectual developmental disorder? And I was like, absolutely. Like I was almost confused by the question because I think in my world, I'm like, it doesn't matter. And she goes, I don't, but I don't know what therapy would benefit. And it was one of those things where we didn't have time to get into it. But then I was talking actually to another parent who recently started Spell to communicate with their child. And she was talking about how the therapist talked to her non-speaking child. And I was like, that's therapeutic in and of itself, right? Because
I know.
like so many people will just like talk about him or look through him or pretend he's not there. And it's like, even that in and of itself, having another safe person that, sees your child? I think absolutely, because the family's used to it. But what's it like, to have other people that aren't close loved ones be able to validate that human experience? So I think first and foremost there. Secondly, what you're talking about is like looking at patterns. It's also going to, she's probably watching, what you're doing and how he's like physically responding to that, because
Sure,
there's
sure.
much communication that happens outside of spoken language. Or, I will work with families as well of like, talking about neurodiversity and autism, the function of communication, sensory needs, language, all of it. And a lot of times as a psychologist, like I'm able to provide a broader perspective, and then I'll refer, like, I'm not going to be the one who is like directly always addressing sensory needs, but there's a lot we can do. But I'm also going to refer to OT, if that, is indicated, that type of thing. But I think that is really important. But I also think, like, at the same point, like you're saying, there's so much traumatic experiences that happen, and being able to have a safe place and have ways of processing that and having another voice. Like there's just so many key things in all of this, I think, that are so important.
Before we finish, I really would like to also talk just about a couple things that, first off, can you give your weigh in on apraxia and how big apraxia is in autism? And has it always been believed that apraxia plays such a big role in autism, or is that something that's relatively new?
Yeah, I mean, I commented because you had an episode, where
I
you were
did.
talking about apraxia. I happened to record an episode yesterday on
Yeah.
apraxia that hasn't aired yet. But I was saying on that, no, I don't actually think it's talked about all that much. I think maybe in your world you see it a little bit more
Yeah.
because of Joey having apraxia. You're tuned into it. You're looking for those, supports. But I think as a whole, we actually are not talking about it
And
any.
just for those who don't know, apraxia is a brain body disconnect. So it's basically you may be thinking you want the body to do something, but the body's not going to do it. And it's a big part of the reason why speech is so tremendously difficult to get out. Sorry. I just wanted to make sure because I always respect the fact that there are people who, who are like, what does that even mean?
Absolutely, absolutely. Yeah, and the most, like, common one that you'll hear about is childhood apraxia of speech, which a lot of non-speaking autistic individuals have. And the guest that I had on yesterday was also saying that, like, apraxia, like, there's been research to show that apraxia is it's much more likely that there's co-occurring conditions that go with it than it for it to occur in isolation. But I think there are a lot of autistic individuals, where this hasn't been identified yet. And there's other forms too of apraxia that can affect, like, more motor movements, things like that too. But yeah, I don't think we're talking about it enough, and I think as a whole, just to emphasize, I don't think we're talking about co-occurring conditions, whether that's mental health, like, for example, like talking about seeing a psychologist. Also, what else is going on? Is there anxiety? Is there OCD? Is there ADHD? Is there depression? Or sometimes I'll, assessing like autistic burnout, things like that. There's such a gamut of things that we need to look that highly co-occur with autism. I have no problem, as a provider, I don't prescribe medic, but I'm constantly educating families about, psychopharmacological options as well in this, but also there's so many co-occurring medical conditions we're not talking about, like Ehlers-Danlos and, GERD and like chronic constipation and like sleep disorders, things like that can dramatically impact quality of life and being able to access the world. And so I think as a whole, we need to be having more conversations about these things.
Two more things along that line. I want to talk looping and OCD, and we'll start just, and then we will call this a wrap. But I wanted to talk about the looping because, sorry, I'm going to edit that part out. So let me just say this one more time. So one other thing in relation to that looping, can we talk about looping? Because looping is something that I see. And is it the same? Is it a type of OCD, or how does that relate to each other?
Yeah, it's a great question. So, what looping is, we often think of it as like cognitive looping, but it also can be verbal looping of like saying the same thing over and over and over again, or thinking about the same thing and getting really stuck. A couple pieces. One, it does have some qualities that are similar to obsessive compulsive disorder. I will say, and I think a lot of my colleagues in the field would agree with this, the differential between autism and OCD is one of the more tricky ones. I have a team of psychologists and we have meetings every week, and like we had like an entire meeting where we were talking about this differential and what really says when it's OCD above and beyond autism. It's looping is one of those things where it is really tricky, where we want to look at like what the level of impairment is with regard to it and why they're doing it, because it also could be perseveration that is part of the autism presentation. But the one thing that I do find interestingly is, and I've talked with numerous psychiatrists about this too, is sometimes in terms of like if you're looking at medicine, treating it in a medication way that's similar to OCD can be really, really helpful. So, for example, like a much higher dose of an SS that can be helpful, but it is a really tricky differential. But a couple things that I often talk about with this looping is one, leaning into it. Our tendency is to try to get individuals to stop it, like stop talking about that. We're done. We're moving on. I like really, and this is affirming too, leaning in and being like, what can I say yes to here? Or what can I hear? Because it helps them kind of process through it. And sometimes it's an easier off ramp too, that if you can't say, like, I have, a kid on my caseload who, really wants like the next big drone and like all of that. And like, financially, that's not possible. I have kids that want to start businesses. Financially and logistically, that's not possible. Right. And so, like, can you like say, okay, let's go research this. We're not going to buy it right now, but can we research it together? Or tell me what you love about this. And sometimes that's a softer exit than trying to do a hard stop. So that can be one strategy to work with. The other piece that I do want to mention though is a lot of these kids that are looping like this or that want things done in a particular way, I'd really encourage families also to look into like the realm of Gestalt processing. So we have Gestalt language processing, but then the broader term is like this Gestalt processing, and Gestalt language processors have Gestalt cognitive processing. And what it is basically your child, or, if this is you yourself, you learn by the wholes and then learn to break it to parts versus learning the parts that create the whole. So you might have the entire Lego set in your mind versus the individual Lego pieces that
Mhm.
eventually you learn to break down. And so sometimes that also can create this looping or this like feeling of just right, because that's how it was one time. And it's like almost like pattern recognition.
Very interesting. Thank you for that. Never had it described so well. That's really fantastic. Appreciate it.
Yeah.
Well, where can everybody find you?
Yeah, on all, pretty much every social media platform, I'm the Dr. Tay. So the period, DR period Tay. I love being able to provide education there. I also have my own podcast, which Betsy has been on, called Evolve with Dr. Tay. I just love being able
Which
to.
is fabulous. It's my big endorsement right now. It's an absolutely fantastic podcast, which
Thank
is
you.
why I'm so honored to have her. So I'm sorry, keep going. I didn't mean to interrupt you. I just had to give you a testimony real quick.
I love it. Thank you. Yeah. It's been such a passion project. I mean, we have over 150 episodes, and I have incredible
Wow.
that, and I do that because I want information to be accessible.
Yeah.
I know especially neurodiversity affirming information is really hard to come by. And then, in terms of services, my website is drtaylorday.com. So taylorday.com. And we do diagnostic evaluations, we do therapeutic services, and we're actually getting ready to launch a membership as well where parents can get
Amazing.
even more of the how-tos, and really understand like how you can support your child in a neurodiversity affirming way, and and do that in your home too, especially if you're not surrounded by a team of providers who really get it, or you are on wait lists. I mean, we see that so often as well.
And I'll put all of these tags in the show notes. Thank you so much for being on the show today. I really appreciate your time tremendously. And I hope we get to talk again sometime soon because it's always a fun conversation when we're together.
It really is. And we got into so much, and I just feel like it flowed. So thank you.
It
It's
was
fun chatting with
so
you.
fun.
Yeah.
It is fun to talk. All right, everybody, thanks for joining us. We'll talk to you next week. Take care. Bye bye.